Good evening, all of you.
Good evening, ma'am. Good evening, everyone.
Good evening. Start our section. Yes. So let me invite Yomi ma'am, Minu ma'am, and Yomi ma'am. Yes, you can start.
Good evening, one and all present here. Today from National Child Development Council, Rising Queen Circle, we are going to organize a webinar on pediatric oral health, facts and myths. So in this, we have written as quote like, give yourself a reason to smile. Yes. So being the reason, some reason for smile is very important to everyone. So nothing we wear is more important than the smile. So for that, oral hygiene is very, very important. For that, we have invited our very special guest over here. Was our resource person is Dr. Meenu ma'am. I want to welcome you, ma'am. So before starting our program, let me see one small thing. Every tooth in a man's head is more valuable than a diamond. That is one of the superb quote where I have read that. So it is very important to teach the children about the importance of oral hygiene and also how to look after their teeth, and also parents should get this about a very good knowledge about this. This is very, very important topic. So we are so happy and glad to have this webinar on this very, very special day. Before start going to our program, let me call Meenu ma'am for start our webinar with our prayer song. Welcome, Meenu ma'am.
Thank you, ma'am. God bless me always. I am your little baby. Please protect me. You are my papa, you are my mama, you are my world as well. Pat me always, hug me always, with your invisible hand. I can see you in a rainfall, I can see you in wind. I can touch you, but I feel you always in my mind. Always in my mind.
Thank you, Meenu ma'am.
Thank you, Meenu ma'am. Yes, Meenu ma'am. So after our superb prayer song, shall we invite our Yomi ma'am for to give a welcome speech for our guest?
Yes. Without a welcome speech, how can we start our program? Yes.
Yes.
Welcome, Yomi ma'am.
Thank you so much. Before that, this webinar is organized by the Rising Queens. So to know more about the Rising Queens and CDC, I'm going to share one video, and all the related informations, we can watch it here. So here I go. My screen is visible, right?
Yes, ma'am.
Students and faculties make it as a family, and even after their course, they are always keep in touch with us. We take pride by knowing that our students are happily working at good position in leading schools and other educational institutions. Our students are spread all over the world and always connected to us virtually.
Hello everyone, I'm Yaumichon Rugui. I'm from Manipur. I belong to the 27th online batch of this National Child Development Council. I'm doing a post-graduation diploma in International Montessori Education. By joining this course, I can see a lot of improvement in myself. This course is full of activities. It's an activity-oriented course, and every day we have 2 hours online class. And it's difficult being a married woman to go out, attend college and learn. But this National Child Development Development Council has provided a platform for ladies to stay at home and learn at our convenient time. So here I practice so many life skills, and it's very fun to attend the class. The faculties are very friendly. My faculty is Shirin ma'am, who is always encouraging, who is always inspiring. So I learn with fun, and I learn so many things from my friends also. All the faculties, all the staffs, and also evaluators are very encouraging and supportive. And by joining this course, I get to refine my skills of a teacher. I learn about child psychology. I learn about the philosophy of this Montessori education, about the various approaches of teaching and learning. And also we have practicals of how to conduct a class, how to let the kids attentive, and we got to learn about so many crafts which we can be used as teaching aid also. And here especially we learn how to be a successful and how to be an inspiring teacher. All the skills and all the requirements that a successful teacher needs to possess, we learn it here and we get trained here. So I'm very grateful to this National Child Development Council, and everything is fun. We are given 50 hours of English fluency class also. So many activities helps us to enhance our vocabulary, to improve our thinking and reasoning capacity also. It's all fun. And so I have so many things to say more, but I want to conclude by saying that this NCDC is a platform perfect for ladies to unlock our potentials, to refine our skills, and to discover ourselves. So thank you so much.
Hi everyone, என் நேம் ஆனந்தி. நான் கோயம்புத்தூரில் இருக்கேன். நேஷ்னல் சைல்ட் டெவலப்மெண்ட் கவுன்சிலில் போஸ்ட் கிராஜுவேஷன் டிப்ளமோ இன் இன்டர்நேஷ்னல் மாண்டெசரி கோர்ஸ் கம்ப்ளீட் பண்ணியிருக்கேன். ஸோ என்னுடைய 1 year எக்ஸ்பீரியன்ஸை நான் இங்கே ஷேர் பண்ணணும்னு சொன்னால், நான் நர்சிங் முடிச்சுட்டு என்னுடைய கெரியர் மிஸ் பண்ணிவிட்டு ஹவுஸ் ஒய்ஃபாக 2 கிட்ஸ்க்கு மதராக வீட்டில் வெயிட் பண்ணிட்டு இருந்தேன், ஏதாச்சும் நெக்ஸ்ட் ஆப்பர்ச்சுனிட்டி கிடைக்குமான்னு சொல்லிட்டு. ஸோ எனக்கு நேஷ்னல் சைல்ட் டெவலப்மெண்ட் கவுன்சில் பற்றி தெரிய வந்தது, என்சிடிசி பற்றி நல்ல ஃபீட்பேக் எனக்கு கிடைச்சது. அதனால் நான் ஜாயின் பண்ணேன். ஜாயின் பண்ணிவிட்டு நான் கேட்ட ஃபீட்பேக் எல்லாமே 100% ட்ரூ. ஏன்னா ஆக்டிவிட்டி ஓரியன்ட் பேசிஸில் இந்த கிளாஸ் எடுக்கிறாங்க. ஸோ ஆக்டிவிட்டி ஓரியன்டாக இருக்கிறதுனால எனக்கு எந்த ஒரு பேர்டனும் இல்லாமல் நான் இந்த கோர்ஸ் கம்ப்ளீட் பண்ண எனக்கு ரொம்ப ஈஸியாக இருந்தது. டீச்சர் ட்ரைனிங் கோர்ஸ் வந்து இவ்வளோ என்ஜாய்மெண்ட் பேசிஸில் வேறு எங்கேயுமே எடுக்க மாட்டாங்க. அந்த மாதிரி ஒரு நல்ல ஒரு பெனிஃபிட்டடான கிளாஸு. ஏன் பெனிஃபிட் சொல்கிறேன்னு சொன்னால், என்னுடைய பர்சனாலிட்டி டெவலப்மெண்ட், என்னுடைய செல்ஃப் டெவலப்மெண்ட், என்னுடைய ஹேண்ட் ஸ்கில் டெவலப்மெண்ட், அப்புறம் என்னுடைய இன்டெலிஜென்ஸ் ஸ்கில், க்ரியேட்டிவ் ஸ்கில் அப்படின்னு சொல்லிட்டு நிறைய வேஸில் வந்து நம்மளே முதல்ல ஃபஸ்ட்டு டெவலப் பண்ணிக்கிறதுக்கு ஹெல்ப்ஃபுல்லாக இருந்துச்சு. அதுவும் இல்லாமல் இப்போ நம்ம கிட்ஸ்க்கு வந்து நம்ம கான்சென்ட்ரேட் பண்ணும்போது இந்த டெவலப்மெண்ட்டில் நமக்கு ரொம்ப முக்கியம் இல்லையா? ஸோ இது வந்து சூப்பர்பாக வந்து சைக்காலஜிக்கலாக வெல் ட்ரெயின்டு ஃபேக்கல்ட்டிஸை வச்சு நமக்கு வந்து ட்ரைனிங் கொடுக்குறாங்க. அது எனக்கு ரொம்ப ஹெல்ப்ஃபுல்லாக இருந்தது. ஏன்னா எங்களுடைய ஃபேக்கல்ட்டி, என்னுடைய வேலுவேட்டர்ஸ்லாம் வந்து நான் ரொம்ப தேங்க் பண்ணுறேன். ஏன்னா அவங்க நிறைய விதத்தில் எனக்கு கைட் பண்ணாங்க. அதுக்காக அவங்களுக்கு ரொம்ப ரொம்ப தேங்க்ஸ். ப்ளஸ் நான் பாபா சருக்கு இந்த மாதிரி ஒரு ஆப்பர்ச்சுனிட்டி கொடுத்து நிறைய விமன்ஸ்க்கு ஹெல்ப் பண்ணுறதுக்காக, அவங்களுக்கு ஒரு கெரியர் வந்து நீங்கள் சூப்பராக டெவலப் பண்ணி கொடுக்கறதுக்காக பாபா சருக்கு ரொம்ப ரொம்ப தேங்க். ஸ்போக்கன் இங்கிலீஷ் வந்து ஒவ்வொரு பர்சனுக்கும் ரொம்ப மஸ்ட். ஸோ இதில் ரேபிட் ஸ்போக்கன் இங்கிலீஷ் அப்படின்னு சொல்லிட்டு 50 daysல நம்மளோட ஸ்போக்கன் இங்கிலீஷையும் டெவலப் பண்ணிவிட்டு 1 year ஃபுல்லாக ரொம்ப ஈஸி மெத்தடில் நம்மளோட இங்கிலீஷ் லாங்குவேஜை டெவலப் பண்ணிக்கிறதுக்கும் வந்து நேஷ்னல் சைல்ட் டெவலப்மெண்ட் கவுன்சில் இந்த பிளாட்ஃபார்ம் கொடுத்து ரொம்ப ஹெல்ப் பண்ணுறாங்க. அதுக்காகவும் ரொம்ப தேங்க் பண்ணுறேன். ப்ளஸ் வேறு என்ன சொல்லணும்னா, என்னுடைய எல்லா பாசிட்டிவ் எக்ஸ்பீரியன்ஸ் வந்து எல்லாருக்கும் ஷேர் பண்ணுறதுக்கு எனக்கு கான்ஃபிடென்ஸ் கொடுத்துருக்காங்க. அதுக்காக, ஏன்னா இந்த கான்ஃபிடென்ஸ் வந்து நேஷ்னல் சைல்ட் டெவலப்மெண்ட் கவுன்சில் தான் எனக்கு கிடைச்சது. அதுக்காகவும் தேங்க். ப்ளஸ் இன்னொரு ஒன் மோர் திங்க் என்னென்னா ஃபினான்ஷியலாகவும் இந்த கோர்ஸ் கம்ப்ளீட் பண்ணேன். நான் ஏர்ன் அண்ட் லேர்ன் ப்ரோக்ராம் ஸ்டூடெண்ட்ஸ்க்காக ப்ரொவைட் பண்ணாங்க. அதில் எனக்கு ஒரு நல்ல ட்ரைனிங் கொடுத்து நானும் அதை ஏர்ன் பண்ணி என்னுடைய ஃபீஸை நான் பே பண்ணுறதுக்கு அது ரொம்ப ஹெல்ப்ஃபுல்லாக இருந்தது. அட்மிஷன் கவுன்சிலிங் ஜாப் பே பண்ணேன். ஸோ என்னுடைய ஹேண்டில் என்னுடைய கோர்ஸை கம்ப்ளீட் பண்ண ஹெல்ப் பண்ணதுக்கு எனக்கு வந்து ரொம்ப ரொம்ப ஹாப்பி. இந்த ஹாப்பினஸை எல்லாருக்கும் ஷேர் பண்ணுறதுலேயே எனக்கு ரொம்ப ஹாப்பி. தேங்க்யூ நேஷனல் சைல்ட் டெவலப்மெண்ட் கவுன்சில், தேங்க்யூ பாபா சார், அண்ட் தேங்க்யூ மை டியர் ஃபேக்கல்ட்டி அண்ட் மை எவாலுவேட்டர்ஸ் ஷெரின் மேம், பிந்து மேம் அண்ட் எல்லா சீனியர் எவாலுவேட்டர்ஸ்க்கும் நான் ரொம்ப ரொம்ப தேங்க் பண்ணுறேன். தேங்க்யூ ஸோ मच।
मैं एनसीडीसी पाठ्यक्रम में अपनी यात्रा के बारे में साझा करने जा रहा हूँ। मैं अंग्रेजी माध्यम स्कूल में पढ़ता हूँ। मैं दायरा प्रवाह अंग्रेजी में बात नहीं कर पा रहा था और जब भी मुझे दूसरे के सामने कोई कार्यक्रम करने का मौका मिलता है तो मुझे मन से डर लगाता रहा था। इसलिए इस कक्षा में शामिल होने के बाद मैं एक गृहिणी से एक शिक्षक के रूप में बहुत कुछ बदला है। इसलिए मैं एनसीडीसी का हिस्सा बनकर खुश हूँ। थैंक यू।
We provide different courses to ladies without any age limit. The courses are Certificate in International Preschool Education, Certificate in International Montessori Education, Diploma in International Montessori Education, Advanced Diploma in International Montessori Education, Postgraduate Diploma in International Montessori Education.
Yes, so that video I shared, it provides information about this rising queen and also about NCDC. Now I want to move on to my welcome speech. First and foremost, I want to welcome our resource person for today's webinar, that is our respected Dr. Minu Prasannan. If I pronounce it wrong, it's my apologies, ma'am. So we would like to give our heartfelt welcome to you, ma'am, because in spite of all your busy schedule and in spite of all your works, you are spending time for us to join with us for this webinar. So we welcome you, ma'am. And also, I want to welcome, in his absence, I want to welcome the master trainer of this National Child Development Council. That is our Baba Alexander sir, who is also a Global Goodwill Ambassador. I want to welcome our Baba sir also. Along with him, I want to welcome our senior evaluators, our senior faculties, NCDC team, and all the well-wishers who are in this program, and also those who are watching live, and also all my friends. I want to welcome you all, and I want to express not really a word of thanks. I want to express my thanks to the Rising Queen team also. Sherin ma'am, not only the coordinator of this Rising Queen, but she's the one who bring this amazing guest in our webinar today. So thanks to Sherin ma'am and all the other members of this Rising Queens, Kartika ma'am, Lindsay ma'am, Ananti ma'am, Minu ma'am, thank you. So before I invite our guest, I want to say a short thing about her. I'm sure she is a lady who is beautiful from the heart. Just look at her, we can see that she is beautifully inside out, and she is also beauty with brain. She is from Trivandrum, India, and she has many work experience, but I will just highlight some. She is a pediatric dental specialist by profession, and she's an entrepreneur by passion, and she has also an online store, designer store, and she is also a writer. She's a fashion consultant and a counselor, and she has also a basic training in child psychology. She is ready with solving real life problems, including moral boosting, family and relationship counseling. So seeing all this, we can say that she is a multi-talented lady. Really appreciate you, ma'am. And so I want to highlight some of her she has so many work experience, but to highlight some, she was she was a former senior lecturer at BSM College of Dental Science and Research. She was former consultant pediatric dentist at DLC Dental Clinic, and she worked at Crowning Glory Dental Center. And she is also a consultant pedodontist at Modern Dental Clinic. And I guess recently she is working as pediatric dental specialist at Government District Hospital, Thrissur. So there are so many things to say more, but we want to say to our Dr. Meenu Prasannan ma'am that we are so happy that you are here today. Thank you so much for coming to this webinar, and we all are looking forward to learn so many things from you. So this entire session is handing over to you. So over to you, Dr. Meenu ma'am. You can take your time.
Thank you so much.
Welcome you, ma'am.
Yes, I think ma'am is preparing to share her slides. Yes, we can see your screen, ma'am.
So I would like to start off with saying that children are the world's most valuable resource and its best hope for the future. So the wealth of a nation, I would say, is not merely on its economical and natural resources, but it is more decidedly on the quality of the nation's children and the youth. So therefore, it becomes very mandatory for every nation and society to nurture the strong, healthy, and to bring about a healthy individuals, citizens, intellectually strong children. So what is health? According to World Health Organization, health is a state of complete physical, mental, and social well-being. And it is not merely the absence of any disease. So when you say you are healthy, it is not just it doesn't just mean that you don't have any disease. It means that you are physically sound, mentally sound, and socially sound. If you have any issues with any of these, you can't call yourself healthy. So most parents know the basics of keeping their child healthy by giving them adequate nutritious diet, giving them proper exercise, providing them proper sleep. But apart from all this, it is also important for them to take the kids for regular checkups with your doctors. I wouldn't say only the dentist, but doctors as such, like more importantly to medical doctors and to dentists also. So coming to the topic of our discussion today, it is pediatric oral health, the facts and the myths, because there are so many myths associated with pediatric oral health. I would like to clear some of them too. And I'm extremely happy and grateful to Mrs. Sharon and NCDC for having me here. And I sincerely hope that this session will be extremely beneficial to all those who are attending in throwing light on all the aspects of pediatric oral health. I would like to introduce myself. I am Dr. Meenu Prasannan. As I was introduced, I am a pediatric dental specialist at Government General Hospital, Thrissur. And I'm also working as a consultant at various private hospitals and clinics in and around Thrissur and Malappuram district. So I intend to bring clarity on all the important aspects to be known regarding a child's oral health and the common myths we often come across, and also the actual facts about the same. So for this, I would be covering this topic age-wise, right from when a newborn is born up till until he or she turns 15 to 16 years, so that we can best relate to the situations and how to tackle each situation. Because most of people I guess are not very much into medical field, or so it is. I think it is best to cover it age-wise so that you can relate it to your kids, or if there are expecting mothers, you can relate it better. So starting with the first 6 months of life, that is like 0 to 6 months, usually infants don't have teeth. So the first teeth usually erupts by 6 months of age, and their main diet is milk, the mother's milk. Now, what is the most important is that oral hygiene habits, that is the cleaning of the mouth, should start from early on in the life. The gums without the teeth, the gums which are present in a newborn's mouth without any teeth, they are referred to as gum pads. So gum pad cleaning, as shown in this picture, gum pad cleaning should begin as and when they are having their milk. So they should be cleaned as shown in this picture using a sterile cotton cloth or gauze wound around the finger. So each time the child is fed, you should clean the child's gum pads using a sterile cotton cloth. And this is because even the mother's milk is sweet, and the presence of this when the tooth erupts can cause decay. And so cleaning is important. And if due to any circumstance we are switching to formula drink or other supplements, care should be taken not to add extra sugar to it, because it is the sugar additive or the milk as such, which causes decay in the milk teeth. And once the baby starts weaning is once the baby starts semi-solids and solids food apart from the mother's milk or the formula drink, that is when we should give at least a spoon of water after each feed, if possible, like after night feed, especially after night feed, because they sleep off suckling the milk, and that the last milk which they have taken in, they tend to pool around the newly erupted teeth, and the teeth will start to decay. So it is always better to wash down the last taken milk with at least a spoon of water. And why this should be done, I'll tell you in the coming slides. Coming to teething. Teething is a process where the first teeth erupts. First teeth erupts generally by 6 months of age. That is the general age at which the tooth erupts. It can be as late as 9 to 11 months also. There is absolutely nothing to worry. Theory says that it's the first tooth erupts by 6 months, but it can be as late as 11 months too. And usually it is a lower front teeth that erupts first, and the process is referred to as teething. It can be the upper teeth also, and the lower teeth might erupt second, but generally it is the lower front teeth which erupts first. So during this phase, the baby will appear generally irritable and may present with one or all of these signs which are shown in the picture. That is, refusal to feed, might cry throughout the night, might bite the mother's nipple, causing pain, keeps waking up in the night, shows irritability. There will be excessive salivary drooling, saliva keeps drooling, and there will be teething rash associated. Where the tooth is about to erupt, there will be a rash seen, reddish rash seen. So what can be done to ease the symptoms? Babies we can elevate their symptoms, because there will be fever, associated fever also. So fever should be controlled with medicines and sponge massage. The pain and the irritation makes them to bite and chew on anything they can get their hands on. So it is at this point that you can give them silicone baby safe teethers. This picture shows the teethers which are commercially available. So you can give them after sterilizing them each day. So make sure that you sterilize the teethers each day, and you can refrigerate it for better, like not freeze them, but refrigerate them, so that the cold teethers will help in numbing the gum pads and will fasten the process of eruption. So by 2.5 to 3 years, generally by 2.5 to 3 years, they'll have all their 20 milk teeth. The number of milk teeth in a child's mouth are 20, which usually shed off by from 6 years to 11 to 12 years, and the other permanent teeth erupt, which are 32 in number. So that is a normal process that takes place, with the teeth erupting by 6 months, and by usually 2.5 to 3 years, all the 20 milk teeth erupt. There is something called natal and neonatal teeth. That is, some babies are born with one or two tiny front teeth, or they appear during the first month of life. So usually they are born with the front teeth. So that is called the natal teeth. The issues associated with these teeth are that many a times they are very mobile, so the chances of them getting swallowed are high. And secondly, they can cause pain to the mothers due to biting on the tender nipples. So these are actually okay. Often the reason why parents come to us is because after each feed or while feeding, they cry very violently, and the parents are clueless as to why the baby is crying. Because usually, as seen in this picture, these natural teeth are associated with ulcers on the undersurface of the tongue, because the tongue is usually protruded to create suction while suckling milk. So due to this, when the babies are brought to us with this complaint, we usually remove them. So it is usually safe to remove these teeth if the baby is more than 10 days old. And if it has to be removed before 10 days, we'll give them a vitamin K supplement and then remove the tooth, because otherwise baby will have bleeding. Now, early childhood caries, I'm sorry with the spelling. So many of you would have come across these conditions like these, which are seen in this picture. And this is referred to as early childhood caries. Caries is nothing but tooth decay. So, and this is the most common reason as to why parents come with their kids to us. So it is to prevent this type of tooth decay that I told you about, the oral hygiene habits, like cleaning gum pads and giving a sip of water after feeding before a couple of slides. And the most common cause is due to the milk pooling around the teeth and the sweeteners which are added to the milk. So what can be done? These decay, the type of decay which we saw in the previous slide, it can be prevented by using tooth cream by the name GC tooth mousse. This is something which is to prevent, that is, you can prevent the occurrence. As soon as the first tooth erupts, you should start cleaning the baby's teeth also. That is, tooth brushing should start with the first tooth eruption. You can use a finger brush by the name Pimple Brush. It is available in all the medical shops and other medical supply shops. So you can start tooth brushing. Other than that, to prevent the decay, you can use tooth creams by the name GC tooth mousse. These are nothing but these are made of milk protein. So it is actually safe for the babies even if swallowed. So it is usually given for babies from 6 months of age. So that is one way of preventing the caries or tooth decay. The second way is to give that is professional application. You will have to take a kid to a dental clinic once in a year or once in 6 months and get fluoride gel treatment done. That is what is shown in the second picture. There are silicone trays like this. You fill in with the fluoride gel and it is placed in the mouth for a couple of minutes, and then it is left as such for half an hour. This gives preventive protection, that is the protection against tooth decay to the teeth. And the third is using pit and fissure sealants. That is, when teeth erupt, the back teeth erupt, there will be deep grooves and pits, small elevations and depressions, and it is into these that the sticky foods like chocolates, biscuits, cakes, which kids love, get stuck to, and they cause decay. So what you can do is, as soon as these back teeth erupt, you can seal them. Those deep depressions and elevations, they are made smooth by giving a sealant. So this is how a sealed tooth looks like. These are the ways in which we can prevent what we saw in the previous slide. If you see, I think a majority of children have early childhood caries. And coming to the treatment, so it is usually for treatment. We don't have many kids coming in for prevention, like for fluoride gel application or pit and fissure sealant application, because of the lack of knowledge. Ignorance is the main reason. So we usually have them for treatment. So what are the different treatments that can be done for children with tooth decay? So if you have a child with a very small decay as shown in this picture, it can be simply filled. This is the filled tooth. we use tooth colored material only these days, so it can be filled and the child will be pain free, because otherwise the child will keep complaining of food getting lodged in between the teeth each time she or he has something to eat. And if it is deep and if there is pain, or if you see a boil on the gums next to the decayed tooth, if you see, or there can also be a swelling on the side of the face as that of the decayed tooth, then we should do a root canal treatment. Root canal treatment is, if see, here the decay is so deep, this black is the decay, it is so deep that it has gone near the pulp. Pulp is the innermost part of the tooth where the nerves and blood vessels are there. So once the decay reaches the pulp, the tooth is very tender or it is very painful to the child, and it presents with pain or the swelling, as I said. So what we do is we clean the pulp portion where the infection is present and fill it up. This red is the medicine which is placed. We fill the tooth with the medicine so that it stays in place for until the tooth is normally shed. Like if it is a bad teeth, it is these teeth are usually shed by 12 to 13 years. So until then, it will stay in place and it will be shed, and the new tooth will erupt in its position. So that is pulpectomy or root canal treatment. Root canal treatment in children are referred to as pulpectomy. And the most common myth or misconception about root canal treatment with parents is that the roots of the tooth is cut off. But that is not so. It is what we usually do is the cleaning of the roots of the tooth of the pus which has caused the pain, and then filling it up with medicine. So when the child has pain, we often have parents asking us, are in these milk teeth, is it so important to actually preserve them by doing a root canal treatment? Can't we just take them off, like get them removed? But the problem is that these back teeth, which I showed you, they are usually lost by 12 to 13 years. And if you neglect the decay when the baby is 2 to 3 years, thinking that it is only milk teeth, then most probably by 5 to 6 years, there will be pain and it will be in a state that you should either get an RCT root canal treatment done or get the tooth removed. So what happens if we remove the tooth? That is in this picture. Here, there was a tooth which was prematurely removed. That is, it should have been gone by 13 years. If you get it removed by 5 to 6 years, what will happen? The tooth was removed, and this is the permanent teeth, permanent back tooth, which erupts into a child's cavity by 6 years of age. So when this is erupting and this tooth is not there, this tends to drift forward. It slides forward, and it is in a slanting position. So one is this tooth is in a slanting position. Second is that by 13 years, when this tooth, this new teeth will erupt in its position by 13 years of age. So this won't have adequate space to come in. So if it doesn't have adequate space, that is, it will either get blocked in the bone itself, and you will have to cut the bone and by orthodontic treatment, that is by fixing wires and brackets, you will have to pull them out, or even if it comes out, it will be in a malaligned position. That is like it will be out of arch, it will be like this. You will have to ultimately get them removed. So if in case there is a deep decay, and if in case a child is in pain or has a swelling, the first and the foremost thing to be done is take them to a pediatric dentist and take an opinion regarding whether the tooth can be saved by root canal treatment. I'm talking about tooth which is in this condition. And if in case we have to remove the tooth, that is like it is very badly destructed, like these which are beyond repair, or we can't save them in any way. Even root canal treatment is not possible. We call them root stumps. These are root stumps. In that case, following removal, we advise a space maintainer. This is a space maintainer. These are ring-like appliances which are stuck to the immediately back tooth. This will maintain the space for the new teeth to erupt when it is time. Like if you give it even at the age of 5 to 6 years, it will be in place till 12 to 13 years, and it will provide the space for the new tooth to erupt in its position when it is like by 12 or 13 years of age. So if in case you get the tooth removed, make sure that a space maintainer is put for the child. So something which looks like tooth decay, but that it is not tooth decay, this is enamel hypoplasia. So what is enamel hypoplasia is that the enamel of the tooth will look like defective. It is not properly formed, and you'll see that the tooth keeps chipping or crumpling down, and the tooth appears yellowish to brown in color. These are usually seen in these front 4 teeth and the back tooth. The back teeth which erupts by 6 years of age, those are the most commonly affected tooth in enamel hypoplasia. So what can be done if we start noticing this? See, enamel hypoplasia is most commonly seen in areas like Alleppey and other places which are endemic for dental fluorosis, where the fluoride content of the drinking water is very high. That is called dental fluoro. It causes a condition called dental fluorosis, and it presents with these similar stains or the crumpling of the teeth. It looks, the enamel hypoplasia is usually seen in dental fluorosis. So what do we do? If it is in the front teeth, we usually give them a layer of, this is teeth with enamel hypoplasia. This is how it finally looks after giving them a layer of tooth colored material, so that it looks like a normal tooth. And the back teeth, it gets very severely affected. See, these back teeth which are severely affected because they are the ones which bear the load while chewing, and they tend to easily crumple. So temporary steel caps can be given, and later on in adulthood, they can be changed to permanent tooth colored cap after root canal treatment until like by 20-25 years of age. If the person feels like they don't want a steel cap in their mouth, they can remove it, get a root canal treatment done, and then change to a tooth colored one. But up till 16 years, we usually give only temporary steel crowns or steel caps. Next is trauma. Trauma to the gums, trauma to teeth, trauma to lips. And this is the most common reason why I receive late night calls. Because of kids falling down due to like falling down from the stairs or from their bicycle or hitting on the side of the table or bed. And these trauma to the teeth per se. I'll talk about the teeth first. So the trauma to the teeth is usually if it is like a mild fracture, a minimal fracture as seen in this first picture, they can be just, simply managed by coating it with the tooth colored material and giving it a final tooth-like appearance. And the child usually does not have any pain associated with such fractures. If it is a deeper fracture like this, there is a bleeding point seen. It means that the fracture is involving the pulp. So you will have to get a root canal treatment done, and then a temporary acrylic cap can be placed up to 16 years, and then change to a ceramic cap or whatever you as per required after the age of 16 years. So if it is deep, you'll have to go for root canal treatment, because otherwise the child will have pain. So to elevate the pain, to remove the pain, we do root canal treatment and then give a cap. The last but the most severe is an avulsion. Avulsion is where the tooth gets removed as a whole from the socket. That is the place what holds the tooth in place. The tooth gets removed as a whole. And what do we do if something like that happens? That is what I would like to stress on, because most of us don't know what to do once faced with such a situation. The first thing would be to bring the child to a pediatric dentist as soon as possible. What should be done at home? You should find the tooth which has come out. It might be like lying on the sand wherever the child has fallen down, you should try to find the tooth and bring that along with you to the dental clinic. And while holding the tooth, care should be taken not to hold on the root part. The crown part, you should hold it on the crown part. And if possible, if it is soiled, that is, if it is dirty, you should hold it by the crown. See, this is how you should hold it. You should hold it by the crown and wash under tap water. Yeah, I'm not very sure whether it is evident in the picture. You should wash it under the tap, gently rinse it under the tap water, and if possible, transport it to the dental clinic in milk. Cold milk is the best. Normal milk is also okay. If you can collect the child's saliva, that is also okay. If nothing is, or coconut water is also a good medium to transport the tooth. If none of these are available, normal water. But don't wrap it up in a paper or wrap it up in a cloth and bring, because we are trying to preserve the cells which are there in the root, and we'll try to reimplant, we'll try to replace it back into the socket. So we don't want the cells to die off while you're transporting it to the dental clinic. That is why we stress on the milk, coconut water, or the child saliva or normal water while transportation. And once in the dental clinic, we can refix this tooth back in a case and stabilize it with tiny wires, same like those which are used for the orthodontic treatment, and fix them. So another thing, I've not put the photo here. Another thing which we can take care is that while during sports, children who are engaged in sports, they can use something called sports guard, especially those engaging in boxing, skating, running and all. This will prevent injury to the lips and the teeth. Lip injuries, usually we stitch them up, suture them up, and they'll heal very fast. Like by around 1 week, they'll heal very well. Next, coming to oral habits. The various oral habits present in children are thumb sucking, as seen in this picture. Thumb sucking is usually considered normal till an age of 2 to 3 years, and after that, if present, it has to be stopped. So it is always best not to let the child engage in it, because once the child is used to it, it is very difficult to bring them out of the habit. So why? Because this can lead to, if you see, once the thumb is placed in the mouth like this, it tends to procline the upper teeth. You see here, the front teeth are proclined, and this will lead to the child keeping his or her mouth open while sleeping, and habitual mouth breathing occurs. We are supposed to be breathing through our nose, but once the child starts to keep his or her mouth open during the sleep, they tend to breathe through the mouth also. So the second habit is mouth breathing. So once we notice the child breathing through the mouth, first is the best thing is to consult an ENT first, because the child could be breathing through the mouth because of enlarged adenoids, and because of which the child is not able to breathe normally through his nose. And so it is usually after an adenoidectomy, that is a surgery for the adenoids, or some spray or medicines are given by the ENT for these adenoid problems. That gets resolved. Once that gets resolved is when we usually intercept the mouth breathing habit by giving an appliance. We give them an appliance to wear during the daytime while they are not attending classes or going out, while they are at home, and full time during the night. So with that, we can intercept the habit within 3 to 4 months. So these mouth breathing habits are usually intercepted after ENT consultation. And lip biting, as seen in this, it should also be intercepted as and when noticed, because all these 3 habits will eventually lead to the tooth getting proclined. Mouth breathing will lead to, you can see the shape of the face. This is a typical face shape which is seen in a child with mouth breathing habit. So all these are intersected with appliances, and usually the correction we can achieve the correction within maximum of 5 to 6 months. So growth modification. Many of us would have come across children with conditions like this. This is like there is deficient growth of one or both jaws, or there is an excessive growth of one or both jaws. Either ways, here you see the upper lip is slightly back and the lower lip is front, which shows that the upper arch is the growth is less and the lower arch growth is more. And here it is the reverse. So if you see these type of conditions, it can best be corrected by 7 to 8 years. You can see the correction achieved. So what most parents don't know is that these can be corrected during the growing age of the child. That is like starting from 7 to 8 years. And if not corrected at this stage, and once the growth is completed, then this growth can be corrected only after 16 years of age, and that too through surgery. So there are various appliances which help in we can achieve, modify, or restrict the growth of the jaw bones. These are some types of appliances which we use to modify these are usually worn during the night time, and like 2-3 hours during day and throughout the night. And you can see marked difference within 2 to 3 months of usage itself. These are extraoral, that is worn outside the mouth, and these are intraoral appliances which are given for these similar conditions. And once we achieve the growth of the skeletal system, that is the bones, we usually finish them off with an orthodontic correction, that is by applying wires and brackets. We complete them with the orthodontic treatment after the age of 12 to 13 years. That is once all the permanent teeth erupt into the mouth. And orthodontic treatment, we have there are many doubts regarding whether teeth needs to be removed or not. That is depending on each case, like depending on the space available. If we need space, we'll remove